Hi, I'm Dr. Jolie Silva, Clinical Director here at New York Behavioral Health. September is Suicide Prevention Month, and I wanted to talk to you a little bit today about some of the risk factors associated with people who die by suicide. And first, I wanted to report an alarming statistic that suicide deaths have an increase of 30% from the year of 2000 to 2020. 30%, and 70% of those people who died by suicide are white males, with the greatest risk factor being middle-aged white males. So some of the risk factors associated with people dying by suicide are mental health problems like depression, anxiety, bipolar, schizophrenia, sometimes health problems too, physical ailments that involve chronic pain, and substance abuse disorders also. So we talk about those health issues, and then we talk about environmental issues that are also risk factors. So people who have prolonged stress, chronic stress, or a significant life stressor like a divorce or a close person passing away. A significant life stressor can also be an environmental factor that increases the risk of somebody dying by suicide. And not having community or family support is also an environmental factor. In addition to having access to lethal means like firearms would also be another risk factor. And also you can look at somebody's history and look at risk factors that might be present in their history. So if there have been previous suicide attempts, that would be a risk factor for future suicide attempts. If somebody has someone they know who died by suicide, that might also be a risk factor. And then childhood trauma, childhood abuse, or neglect would also be some historical risk factors. But there are also protective factors that I would like to focus on also. So having family support and community support and social support would be a protective factor. Having involvement in culture or religion that really discourage suicide and offer support for people battling with that would be another protective factor. And having access to mental health services and being proactive to engage in mental health services would also be another protective factor. But feeling connected with other people is really important. So what are some warning signs if someone you love or someone you know might be at risk for this, or if you're worried that you might be at risk for this? Well, if you hear people or you hear yourself talking about things like feeling hopeless or feeling as though you're a burden to other people, feeling trapped, talking as though you're in unbearable pain, things like that would be signals that mental health treatment is not only recommended but probably necessary in order to deal with some of these cognitions and ways of self-talk. And some behaviors you can look out for would be isolating from friends or family, withdrawing from activities, increase use of substances, and showing signs of aggression, or a depressed mood, or lots of fatigue, changes in sleep, sleeping too much, sleeping too little. Those might all be signs. Now, what can you do if you're concerned that you might be at risk, or that you might be suicidal, or that somebody that you know is at risk? Well, the suicide prevention hotline has changed its number recently to 988. That's it. It's 988. And they did that for a reason, right? Because it's easy to remember. You don't have to remember a big long number. 988 would be the number to call if you're concerned about somebody you know or yourself. If you have any questions about suicide or you're concerned about it, you would dial 988. And of course, like always, here at New York Behavioral Health, we have a whole staff of mental health service providers. We provide consultations, we provide sessions, we provide treatment. And we deal a lot with people with different mental health disorders who might be at risk for suicidal behavior. So please feel free to visit our website, newyorkbehavioralhealth.com, if you want to schedule a consultation or an appointment with any of our mental health professionals. Thank you.